Malaria Consortium Agency of WHO launched and distributed 2023 seasonal malaria chemo-prevention for children under the age of 12 months to 5 years through the Ministry of Health at the Government House, Lokoja. Governor Yahaya Bello, represented by Deputy Governor Edward Onoja during the launch, pledged to scale up innovation and deploy tools to combat malaria in the state to over 1 million children across the state. Our reporter, Faith Abdelgafar, has more.
On behalf of the good people of Kogi State, I therefore flag off the 2023 SMC program in Kogi State open to the glory of God and to the rest of humanity.
The governor, through his deputy Edward Onoja, said his administration is set to total eradication of malaria amongst children in the state. Onoja noted that malaria remains the leading cause of mortality in Nigeria, especially among under 5 years children and pregnant women, reaffirming government's commitment to tackle it.
Nigeria suffers the world's greatest malaria burden with approximately 21 million cases and about 207,000 deaths reported annually. Apparently, 27% of total malaria in Africa and also 97% of total population of Nigeria is at risk of this surge of malaria. This constitutes heavy economic losses to the nation and Kogi State in particular. It is also important to reiterate that this administration is committed to considerable reduction in malaria incidents in children less than 5 years, as well as pregnant women, and to strengthen routine healthcare service delivery, all of which are essential for improving the health of women and children in Kogi State, as largely covered by the Bello Care initiative. This administration is therefore flagging off this year's 2023 seasonal malaria chemo-prevention to commence mass drug administration in the state aimed at zero malaria prevalence in children below the ages of 5 in Kogi State.
He urged stakeholders to embark on advocacy and sensitization campaigns to inform the danger malaria poses and why chemo-prevention is the answer. Onoja advised parents to avail their children to receive the doses to reduce the spread of malaria that can cause death amongst children.
On this note, I would like to call on all the executive chairmen of the 21 local government areas of Kogi State to accord necessary assistance to ensure the success of the program across the states. I equally implore the traditional rulers, religious leaders, women groups, community-based organizations, and other critical stakeholders to sensitize, mobilize the people in their area to ensure that children within the age group receive the full course of this year's 2023 SMC medication.
The Commissioner for Health, Dr. Usman Zakari, said the SMC for Kogi has since 2021 recorded huge success with support from the Bello Care initiative and other partners. He advised parents to ensure that children partake in it.
Around rainy season, usually for Kogi State, we do it between June to October. We are in collaboration and partnership with Malaria Consortium. They are actually the ones that are implementing the program. When the donors donate drugs to us, we have about drugs enough for close to about 1.2 million children between ages 12 months to 59 months. And this distribution is going to happen across all the local government of the state, in all the 239 wards. The items are here in the state medical store. The first level of distribution as far as the last mile distribution. So when they get to the facilities, we have the fixed post facilities, and then they go into the communities. They distribute them door to door. There are about 14,000 volunteers that will be doing the distribution. And there are means of verification to ensure that these drugs are actually not only distributed but are used by families. Malaria chemo-prevention has already been tested, and research has shown that it is very, very active in the reduction of malaria cases, between 70 to 80%. And we all know that the major killer of children less than 5 years is malaria. And these drugs are distributed free. They are not available in the commercial shops, and nobody will collect a dime from anybody when they bring them these drugs. Prevention, they always say, is better than cure. If this is coming, I expect the beneficiaries to utilize this opportunity to prevent malaria. Talk to your wards. When they are given, they should use those drugs as prescribed.
In their separate remarks, SMC State Project Manager Kenneth Maduka, World Health Organization (WHO) State Coordinator Dr. Marcus Oluwadere, UNICEF Representative Dr. Adeyeye Olumide, Executive Secretary State Drugs Management Agency Mahmoud Ozigi, and others at the event commended Kogi State to have made a remarkable record from 25 to 16% malaria reduction rate, confirmed by the Malaria Indicator Survey.
If you look at it, 70% of deaths in malaria occur in children under 5 years. So this has been shown to prevent more than 80% of severe malaria. And we have been able to reduce the prevalence of malaria in Kogi State from 25% in 2018 to 16% in 2021. So beneficiaries should allow their children to have access to medicine and complete the medicine.
This is a very laudable program that WHO is ready to support the government technically and otherwise. So I want to congratulate the Executive Governor and the Ministry and the Commissioner for Health for bringing forth this program at this time. I know with this, malaria will be a thing of the past in Kogi State, in Nigeria, and in Africa as a whole.
This malaria chemotherapy prevention is a very good project that will actually bring down the malaria burden in the state. The drug available will assist the under 5 children to prevent them from getting malaria season of malaria. So this is actually a very good time and the best time for this project to take off, and also want to encourage the caregivers to bring out their wards to access this drug. It's free of charge so that their wards and children can be prevented from malaria infection.
I want to use this forum again to appeal to all stakeholders that the Drug Management Agency, I can assure you, is bigger, larger, more accommodating than most of the agencies in the country. I have interacted with my colleagues outside. You will not know what you have until you compare it to others outside there. But you know, we suffered a little bit of the NSARS. We're trying to restructure ourselves, we're trying to reposition ourselves. I tell you this, once that happens, Kogi State Drug Management Agency is not going to be only Pharma E-grade, it's going to be one of the best in the country. We have a prototype. The reference hospital is standing tall and is putting us in a strategic position. So I'm going to appeal to everybody and urge that we come out en masse, embrace this program, talk to our people, let us get these things done. Since Nigeria is one of the biggest factors for this malaria issue, we can change it, we can do it. If the government is changing the position of health sector in the state, then we, the citizens, can do our part by assisting to change that.
They urge beneficiaries to grasp the opportunity for their good.
Indices in Kogi State is reducing. We are at 16%, and that is a very good applause to the supporting partners, and we would keep on encouraging them to continue to support the state in every way necessary so that we would break the genes of malaria being endemic in Nigeria and Kogi State especially.
Malaria Consortium, our partner, and all other partners on health in Kogi State for providing the enabling environment for them to thrive. Because without his support and providing that enabling environment, we will not be here today. Thank you, Your Excellency.
On behalf of the management and staff of Kogi State Specialist Hospital, I'd like to say that we commend this laudable intervention. The hospital itself and its staff are also committed to the reduction of the prevalence and mortality of malaria.
The exercise, which will feature free house-to-house mass drugs administration for malaria prevention across the state, will be conducted by the Malaria Consortium in collaboration with the State Ministry of Health to reach out to more than 1 million children. Faith Abdul Ghaffar reporting for MSC TV.